Nice.
Yeah. Thanks for sharing that.
Yeah. Awesome. We ready?
It's working on it. There you go.
Awesome. And rolling. Good morning, everyone. Or I guess, should I say,
Yeah, thanks for sharing that.
guys?
Yeah.
Welcome back to We Wish You Well. It's been a couple weeks. We've missed some episodes and segments. As you can see, we have our lovely guest returning, Mr. Rob Woodard, myself, Dani Sommer, and Mr. Gordon.Chavez. Rob is joining us today as a Medicare specialist and not the CFP that you saw him as before. I thought that when Rob was done working as a CFP, he would be ready to retire, but he is embarked on a new business adventure. And considering there is a lot of confusion about Medicare, I personally don't know much about it whatsoever. I know there's probably more people with questions. We wanted to bring him on and give us some insight and some basic knowledge as to how Medicare is beneficial, for the people who can utilize it, and, just get some more information and see how it can help not only ourselves, but our families, friends, whatever that may be. So Rob, if you want to give us a little background and tell us why you don't have your toes in the sand on a beach somewhere and you chose to get into Medicare, we would love to hear about it.
Well, Dani, thanks a lot for the introduction. I appreciate it very much. And it's really a pleasure seeing you again. And I think you're in Hawaii now, so I can see where the question is coming from. And you use the word adventure, and starting my own business after working for another company for basically 35 years after I got out of college. That's how long my career working with other people has been. So it really has been less of a venture and more of an adventure, as you said. But, like I said, my name's Rob Woodard. I've worked in the financial services industry for 29 years. And some of those years I've been a broker, financial advisor, insurance agent, branch manager, and a CFP. And now I work helping people make the most of helping them get an informed decision how to receive medical care after they've stopped working. And just so you know, I don't qualify for Medicare yet, Dani, because I'm not 65. And to qualify for Medicare, you must be a legal resident, you must be have worked for 10 years, and you have to be at least 65. There are other qualifications for people that have Lou Gehrig's or end-stage renal disease. The age requirement isn't there. And so there's several exceptions for those qualifications of Medicare. So any questions on that, by the way?
Not so far.
Okay, good.
Sure, there will be plenty to come.
When you asked me to do this, I thought, what can I do? And I think the first thing is that most people are extremely confused about Medicare. And I think most of the confusion, or a lot of the confusion, has to do with just the words that the government has chosen to call these things. And I'll get into that in 1 second. But I'm hoping at the end of today that there's going to be an understanding around 6 major areas. And that is, what is Medicare? The next is understanding the different options, the main options that people have. And my belief is that if people can understand the main 2 options that they have, it's actually the main 3 options that they have, then as they're progressing along this exploring of this hugely important topic, as we get older, our health usually doesn't get better, it usually starts to decline. So medical matters are on the minds of a lot of people over 65. Mm-hmm. Next is understanding how to pick plans and some of the main factors that people decide to pick plans, and what their ongoing experience is going to be once they're in the Medicare system versus being on private insurance with an employer or self-employment through Covered California in the case of California. And then the fifth topic I'd like to talk about very briefly is just some of the upcoming changes in Medicare. And then basically, last thing is how to take action. When to take action, what are some of the major factors, what are the different ways, the major ways that a person, an individual can go about getting informed about which is the best plan for them. So that being said, what do you think? Would you like me to get into it, or do you have any questions from that point?
I think that was very explanatory as to what to expect. So yeah, I think you have some slides that you want to share with us.
Oh, I'm going to share slides. Okay, let's see here. I think I know how to do this. That is under share.
Yeah.
And I'm going to share the screen right here.
Perfect.
You see that?
Yes, sir.
Okay. Guess I can make this bigger. Okay. Oops, that's the wrong thing.
That's okay. We'll get there eventually.
Some insider notes right there.
Yeah.
Okay, good. So, 8 tips about Medicare. All right. First off, what I didn't understand when I was a young person, and I used to be a young person, I didn't think Medicare was going to apply to me. I thought, I'm not going to need that. I'm going to be healthy and I'm going to be rich. And, come to find out is that 97% of people in this country over 65 use Medicare. And it's because that's the way the program has progressed. So back in the 60s, something called Original Medicare was voted on and passed by both parts of Congress and signed into law. And essentially the idea is that people were living longer and longer and medical costs were going up. And so Part A and Part B were brought into law. Part A is for hospitals. You go into the hospital and you're on Medicare, Medicare is going to pay for 80% of your hospital stay. If you need to go see a doctor, or if you're in a hospital and 10 doctors come see you, 80% of the costs that the physicians charge you are going to be paid. And if you go see your regular doctor for a cold or other ailments and you're on Medicare, Medicare is going to pay 80% of that. Okay. Now, very briefly, I took an example of someone it's very close to me, and I know exactly what their medical costs were, and they had a stent put in a few years ago. If that person was on Medicare and they did not have anything other than Original Medicare, the costs that were charged them were about $90,000. And this person's out-of-pocket costs would have been about $14,500. Okay? That's how much they would have had to pay. So that's Original Medicare, guys. Original Medicare pays for 80% of hospitals and physicians. Notice I didn't mention drugs or the pharmacy, because that's not part of Original Medicare. That's called Part D. We'll get to that in a second. The reason why people get really confused, and the reason why your clients and our friends and parents and so forth feel like they're pulling their hair out, is as they approach age 65, they're getting just inundated with something I call a mail storm. Every insurance company out there knows that they're turning that age, and they're just inundating them with all sorts of different information, and it's very confusing. The mail that they're getting isn't coming from the U.S. government. In fact, if you look at it, it says we are not affiliated with the U.S. government. These are insurance companies that are trying to get their business. And those insurance companies are offering one of 3 different offers. The first is something called Medigap or Medicare supplement. Those mean the same thing. Remember I told you that part of the problem with Medicare confusion is the words? Medicare supplement and Medigap mean the same thing. Medicare Advantage and Part C mean the same thing, and I'll distinguish those in a minute. And then there's something called prescription drug plans, which is the same thing as Medicare Part D, because unlike original Medicare, you can only have prescriptions through a private insurer, through PDP, a private prescription plan. Okay. So, questions so far. Medicare, and then the reason why people would want to have something else is to prevent that 20% cost that Medicare isn't taking care of. I think I mentioned this on my last call. Most Americans in this country have less than $1,000 in savings. So the idea of being able to pay for $14,000 out of pocket is something that would be remarkably hard. So instead of facing up to that when people retire, they decide to either go with a Medigap or a Medicare Advantage plan. Okay, Medigap is the same thing as Medicare Supplement. I'm going to say this like 10 times. Medicare Advantage is the same as Part C. And if people can understand just that division, most of their confusion goes away. Okay. Now, before I get going, I can take questions, but I'd like next to explain the difference between a Medigap, Medicare Supplement, and Part C, Medicare Advantage. Are you ready for that, or do you have any questions?
We're ready for that.
All right.
Yeah,
we're ready. Medicare Supplement. Think of Medicare Supplement is the most expensive option, but it's the best for catastrophic coverage. Medicare Advantage is the best for least expensive, and those are divided between HMO and PPO. Okay. We're going to talk a little bit more about this in a second. I might as well do it now. Before I do that, let's talk about costs for Medicare. Medicare Part A, zero cost. Medicare Part B is subject to IRMA, and here is the IRMA chart. For an individual making $103,000 or less, they're going to pay $174.70 a month. Okay. That goes to the government, not the insurance company. When you turn 65 and you choose Part B, they're going to either take $174.70 out of your Social Security check, but if you're not taking Social Security yet, you're going to have to pay them directly. Again, you'll see if someone is making over $500,000, they are going to pay $594 a month. And if they're married, this is per person. Okay. So I have a little pro tip up here. You guys are financial professionals. And sometimes if you're dealing with somebody who's just getting on Medicare, maybe they sold a house 2 years ago. By the way, IRMA is based on 2 years prior tax return. 2 years prior. So 2024 Medicare is looking at 2022 taxes to decide how much to charge you for the premium. Let's say that person had sold a house the last year they retired. Maybe they moved to wherever they wanted to move, and they took a big capital gain. And so they're in this area, $594 a month. Well, there is a way that their CPA can apply for a one-time exception, and Medicare will drop their premium. Social Security will drop their premium back down to the minimum or wherever they qualify. So it's one thing I never knew about, and that's one of those things that can save your clients thousands of dollars a year And I think it's a good way to create loyalty for people. If they didn't know that before, they'll certainly like you for knowing that then if it applies. Make sense?
Yes.
Okay, so that's Medicare cost. That's going directly to the government. Now, Medigap or Medicare supplement plans. Medigap takes all of the deductibles away, depending on which plan you have. And Medicare Advantage reduces them and charges a deductible or copayments. Medigap for a 65-year-old male. Again, this is a broad, I'm going to give you a range, depending on the provider, $145 to $165 a month for a Medigap Medicare supplement plan. A Medicare Advantage plan, as little as $0 a month. Okay. The difference is Medigap allows you to pick whatever doctor you want. 95% of doctors choose Medicare, and they use Medicare. And as long as they're accepting patients, a Medigap Medicare supplement policy allows you to go to any physician you want to. So imagine somebody who has a rare condition or needs the best specialist out there. They don't have to worry about HMOs or PPOs. They don't have to worry about the insurance company approving the procedure. If you have Medigap, you can choose your doctor. You can create your own team of physicians. And as long as they take Medicare and are accepting new patients, they're going to get paid, and you're going to get whatever procedure they think is the necessary one. Make sense?
Yes.
Medicare Advantage. Like I said, those are either HMO or PPOs. Guess which one is the least expensive? HMOs. And so with an HMO, you're usually constrained to a few hospitals in a specific area, and the costs on a Medicare Advantage don't come in the monthly premiums, but they come in the coinsurance or deductibles that they might have. So take my example before. Okay. In both cases, both of these patients would have to basically, the Medicare supplement would be $0 to go to the hospital if they had a Plan G, and $0 for the physicians. A Medicare Advantage has a out-of-pocket maximum. So depending on the plan, the lowest maximum out-of-pocket maximum I've seen is $750. The maximum out-of-pocket maximum I've seen is $10,000. So no monthly payment, and there's that out-of-pocket maximum that you get. And again, the disadvantage of there's a couple of disadvantages of Medicare Advantage. And one of them is that the procedure needs to be approved by the insurance company. And I'm not saying they're not approving them. I'm just saying that that's an extra step that has to be gone through. What's the disadvantage of a Medicare supplement plan? Well, you've got to create your own team. If you're in a Medicare Advantage, that team is basically being created when you select your primary care physician. Okay. Medicare Advantage plans almost always come with a prescription drug plan attached to it. That's part of the monthly premium. Medicare supplement don't include drug plans. So somebody who's opting for the Medicare supplement has to pay for the Medicare supplement monthly fee and a prescription drug plan. Okay? So it's more expensive on an ongoing basis, but it has greater catastrophic coverage than a Medicare Advantage. Fair enough?
Yeah. So the Medicare supplement is pretty much all inclusive?
Yes.
Okay. Just wanted to clarify. And the Medicare Advantage, it limits your choice of doctors, and it doesn't have a prescription plan.
It does.
Oh, it
Medicare
does.
Advantage does have a prescription plan. Medicare supplement does not.
Okay. They're so closely related and
Good.
have so much, in common that It's easy to mix up which one gets which.
Yeah. I, at the end of this call, I'm going to be giving you a test, Dani. And so, no,
I'm gonna
it's
flying colors.
like I said, that one of the main problems is the nomenclature that these are throwing at us. And it's very difficult. If you can remember, Medigap and Medicare Supplement are the same, and Medicare Advantage and Part C are the same, then when you get your mailer, oh, this is an Advantage plan. I'm not interested in an HMO or PPO, or I am. I don't want to look at a supplement because I know that's going to be more expensive on an ongoing basis. So imagine somebody who doesn't have many medical conditions at all, isn't on any medicines, and they're not worried necessarily about their health. They're worried about, why would I pay $165 a month when I never go to the doctor? They would kind of naturally gravitate toward a Medicare Advantage plan versus someone who has been encumbered with lots of situations medically and can see the value of spending a little bit more money for a Medigap plan.
Right.
Okay. So I've kind of got in a little bit into one of my other bullet points, but that's helping people decide the difference between Medicare Supplement and Part C. Now, some other things that I didn't cover. Medicare Part A does have a deductible of $1,600 per benefit period. So remember I said Medicare Part A, so we're back to original Medicare. Mm-hmm. You don't pay any monthly fee, but if you go into the hospital, you have to pay $1,600 before Medicare starts covering the 80% of your costs. Now, that is split into 90-day increments, so it's possible to go into the hospital 4 times in a year. Again, Medicare Advantage and Medicare Supplement plans will take care of that cost. Medicare Part B has a 226 annual, and there's only one benefit period. It's an annual benefit period of 226. So that's got to be paid unless you're in a Medicare Supplement. Okay. So you've kind of been asking questions as you go along. I do have a couple of things I'd like to talk about when you qualify and different enrollment periods, but I don't want to go too fast.
I guess I have a question. What are like some of the concerns people have when they're trying to decide which plan is appropriate for them?
You're stealing my thunder. But the idea, it's cost.
Cost, yeah.
It's, I really love my doctor. I've been going to see my doctor for the last 10 years. I don't want to lose my doctor.
Gotcha.
And that loyalty comes at a cost sometimes. And then the next one, and just depends, are the pharmacy.
Right.
Can I tell you a brief story? I just dealt with somebody last week, a lung transplant recipient.
Wow.
His Part D, his prescription drugs, were either $110,000 a year or $8,900 a year.
Oh,
wow.
Now, to have the doctors, he had to choose the plan that had $110,000.
Mm.
But to not have the doctors, he could choose the lesser Part D plan. Mm-hmm. Now, for him, he has, I haven't brought this up yet, or maybe I did, qualified coverage, credible coverage. If you or your spouse are employed and you're on their insurance, you have credible coverage and you don't have to worry about signing up for Part A or Part B. Gotcha. If you're on Social Security, you'll automatically be enrolled in Part A. If you have end-stage renal disease or Lou Gehrig's, you'll automatically be enrolled. And if you're on disability, you will automatically be enrolled as well. Notice I didn't say Part B.
Right.
Now, if you have credible coverage, you don't have to get onto A or B. If you don't have credible coverage and you don't get onto A or B, you'll have a penalty for B and a penalty for D starting 3 months after the year your 61st birthday. And a year after that, you'll begin paying a 10% penalty, meaning your costs are going to be 10% higher for the rest of your life for D and B if you don't sign up without credible coverage. Make sense? So
Yes.
even though you're not utilizing A and B, let's say somebody just said, I don't want to pay the government any of my money, and they don't pay B or D, but they don't have insurance, they are going to get, when they eventually do get on B or D, they'll end up paying about a 10% penalty per year that they held off.
Or not signing up when they were supposed to.
Right. Right.
Okay.
So,
I got a question. I'm
yes,
sorry, Rob.
go ahead.
Go ahead.
No, go ahead. No, you.
So is anybody exempt from having any part of Medicare at all? Like, let's say somebody is, just financially independent and they have their own doctor, they do everything on their own. Does anybody connect? You said that there's automatic stuff like when you go on Social Security. So if you're that person, then you give up Social Security, right? If you don't want to have to automatically be signed up for something like that. Or you said, I think Lou Gehrig's disease. If you have Lou Gehrig's disease, you're automatically signed up. Can anybody just bypass it completely, I guess?
Okay, so let's go back to Part A. Part A, there's no fee.
Oh, okay.
To sign up for Part A. So there's not a reason not to, in financial reason that I can think of. Part B, if somebody doesn't want Part B, they don't have to sign up for Part B ever.
Okay.
Or Part D. Part D is the drugs. Now, when I get into the Part D plan, you might say, maybe even somebody who's financially independent would want to do that. A lot of wealthy people that I've dealt with in my life don't like just throwing money away. And Part D, the price of drugs off the shelf is a lot higher than after the government contracts, which is where Part D comes in, and then the private insurance contracts to distribute those. So, and there's, if somebody's really wealthy and they're paying $580 a month for Part D, for Part B, and it saves them $250,000 because of a 10-day stay in the hospital or $1 million because of a cancer, they might be interested. It's kind of like an insurance. This is an insurance. It's a Medicare insurance.
Yeah.
Did that answer your question?
Yes. Yeah, definitely. Yeah. Thank you.
So let's take the reverse. Let's say somebody doesn't have enough money. Let's say that they were self-employed and their Social Security record is $700. And then the government wants to take $170 out of that for Part B. Well, that's when state programs come in, like Medi-Cal and Medicare. I'm sorry, Medi-Cal is the California program for Medicaid. Medicaid is the nationwide program, and in California we call it Medi-Cal. They will actually pay for the drugs, and they'll pay for the Part B deductible.
Okay.
Yeah. So there is some stops for people that don't have the financial resources to pay for Medicare.
Oh, great. Okay.
Yeah. Okay, so I'm going to go talk a little bit more about Medigap and Medicare Advantage. One of the things that happens with Medicare Advantage is because, did my camera just drop off? Sorry, guys.
Oh, you're good. Yeah, I don't see your face, but I do see your presentation still.
Okay, trying to work again. Can you hear me?
Yep.
Okay, good. Yeah, it says it's on.
Mhm.
All right, sorry about that. I'll have to figure that out as we go along.
No, you're good. No worries.
Okay, so Medicare Part A and B, but let's go to the supplement plans. Those are the Advantage plans. I should say Medicare supplement plans. Those change every year, sometimes a lot and sometimes a little. Okay, and what I mean by that is that the what they cover, how much they charge, can change year by year. The doctors, we just had a recent scenario in San Diego, in North County, San Diego, where a couple of major Medicare Advantage providers got thrown off of the plan with Scripps. So Scripps Encinitas, we had 35,000 Medicare Advantage beneficiaries last year that had 90 days to find a new Medicare alternative.
Wow.
So this is because each one of these are governed by contracts that are signed every year. And we're in the period right now of the year that those contracts are being signed with hospitals, with physicians groups, and with drugs, with prescription D plans. All of that stuff right now is being hashed out. And the open enrollment period, which happens between October 15th and December the 7th, is going to be coming up. And that's where the majority of people who already have a plan look at their current plan and make sure that it still has the benefits that they're and the features that they're looking for. Okay. So again, remember I mentioned the maelstrom. When you turn 65, there's another one that comes. It's coming up in a couple of months, and that's the busiest time for my business.
Gotcha.
There's also, so at that period, when you have a Medicare Advantage plan, it's called open enrollment, because you can say, you know what, this one doesn't suit my needs anymore, or my doctor's no longer taking this plan, and so I'm going to sign up for this new plan. Okay, and they've made it pretty easy to sign up. They've made it harder to explore exactly what's out there. And I've got a couple of resources. If somebody wants to do this on their own, they can go to Medicare.gov and they can actually enter in their prescriptions, and it tells them if they're covered and what types of plans in their area are available. And they can also go to Medicare.gov/plan-compare, and that'll help them decide per their zip code what plans. And then there's people like me who are independent agents that can do the work for them and talk about the variables and help them sign up. And then there's captive agents that work for the insurance providers. So in other words, if you get a card and it's from an insurance company and you call that card, you're going to be talking about that one insurance company's services. You're not going to be talking about all of the different services out there. So that's one of the things that drew me. Dani, you asked kind of one of the reasons why I do this. I don't get paid by, nobody in my position gets paid by the individual. The individual doesn't pay anything for our services. That's paid by the insurance company. And because I get to choose and can choose the best plan for each beneficiary. I mean, the only conflict would be if one company is paying a little bit more. I like to think that I would never be swayed by a few dollars here and there. I'm much more concerned about building a relationship with somebody and making sure that they're taken care of. That's why I like doing what I do, being able to provide the best service to somebody, helping them navigate through this really confusing government program. Okay, so next, I went through the IRMA. I already talked, Dani, you asked about the different reasons people choose plans. Again, hopefully I explained Medicare, Medicare Supplement and Medigap, and then Medicare Part C, also called Medicare Advantage, are the main turning points of somebody's decision. And hopefully I've explained why a person would choose one versus the other. Medigap is more expensive than Medicare Advantage unless there's major medical situations. Medigap plans are standardized. Again, you'll see A through D, F and G, and K through N. Well, each one of these, if you go to a United Humana versus a Aetna, they're going to be the same. They're going to have the same benefits associated with them. Some of them, to compete, will add extra benefits like gym memberships or some sort of vision or hearing benefit. But they have to have the minimum benefit to qualify as an A. The reason you see an F there is that plan is no longer available for people if they qualified for Medicare after the year 2020. G is the plan. Remember, I gave you quotes for a male turning 65 from 145 to 165. That's a G plan. That's you're paying maybe $30 or $40 more, but all of the deductibles are being taken care of except for that $226 for Part B. Okay. Like I said, 95% of physicians in the country accept Medicare Supplement. About 10% of those can charge what's called a surcharge of 15%, and the beneficiary is typically responsible for that surcharge. Costs go up with the Medigap. Again, you cannot be denied a Medigap policy if you sign up when you're 65. Can't be denied. And as long as you keep it, they can never kick you off for medical reasons. Okay. And like I said, it's a cafeteria style. It's very customized, and it's the best plan for catastrophic coverage. Medicare Advantage, in other words, Medicare Part C, these plans are not standardized at all. They're private insurance companies that compete on benefit and costs. Plans can change year over year. They're either organized in the HMO or PPO. Do you guys want to know the difference between an HMO and PPO, or do you know that already?
I was going to ask that.
Okay.
So yeah, please.
Yeah.
I've always been confused about that. I'm like, why do there have to be so many different things? Can't it just make sense?
Yeah. Amen. I know exactly what you mean. That keeps my life interesting. So HMOs are set. So think of them as the institution, sometimes a hospital or sometimes an organization like Kaiser says, this is what we provide, period. These physicians work with us, basically, period. And if you're going to see somebody in Carlsbad and you need to have your eyes looked at, or you broke your leg or shoulder or something, you're going to go to a specific facility to have that done. Okay. So I used to have Kaiser, by the way, many, many years ago. It was simple. I knew where I was going. I knew what I was paying. It was less expensive, and HMOs are the least expensive of these choices. PPOs are a little different. You get into a group of physicians, And there's different groups that these plans provide, so you're not stuck with one. And if you don't like the referral you got from your primary, you can go see another referral in that PPO. There's multiple physicians in that group for the same specialties in different areas. Generally, HMOs have a smaller geographic area and PPOs have a wider geographic area. And why that's important is Medicare Advantage plans have higher co-payments for out of network. So you still can have care, but if you're going out of network, then you're paying sometimes as much as 40% for out of network services up to your out of pocket maximum. And both HMOs and PPOs, the insurance companies got to approve the procedures. Costs are between 0 and 60 monthly, including Part D. Again, this is significantly less expensive than the supplement. And many of these plans, they go crazy on extras. I talked to a lady yesterday. She's getting unlimited rides to the hospital. It's why she chose her plan. She's losing her driver's license, and she's getting free transportation to and from the hospital or to her doctors, unlimited. And that's why she chose her plan. And she likes the doctors in her, that was an HMO. But gym memberships for free, dental give backs, vision, hearing, some of them give hearing allowances, and so forth. And another advantage of Medicare Advantage is it's kind of a one-stop solution. You sign up, you're in the groups, and as long as you're in it for the year and they're not changing their doctors or anything, all you really need to look at is making sure that the plan is continuing to benefit you year over year. I know I did a lot there, but any questions on that?
Is there any circumstance where an individual would be denied coverage completely?
Well, theoretically in a PPO or HMO, they could say, hey, look, we cannot allow you to sign into this plan. Your out-of-pocket maximums are far too high, so we have to shift you over. But there's no rule on that. And by the way, CMS is the governing agency for this, the Center for Medicare Services. And these private insurance companies are held up. I mean, they have star ratings on the line. So if they have a lot of complaints, it affects their star ratings, and their star ratings, everybody asks, hey, what's the star rating of this company and so forth. So it would have an impact on them getting business. So the reason I mentioned that, Dani, is that there is a grievance process. It's the insurance company has to respond within 7 days of a grievance, and then a resolution, I think it's within 21 days, has to be given to the patient, unless it's a life-threatening thing, and then it's a matter of less than a week that process is happening. So it's pretty formalized, and it's pretty controlled.
Okay.
Yeah.
I got a question for you, Rob.
Yes.
So did you say that once you get started with, let me look at my Medicare Advantage, and you get started and you keep paying for it or whatever, you can never be denied later regardless of health?
Medicare supplement.
Medicare supplement.
Yeah.
And
they can't change what you're getting on the Medicare supplement. They can change the price, but not what you're getting. Yeah.
Okay. Okay, so Medicare supplement is the same as Medigap, right?
Yes. Yeah. All right.
I learned something. But Medicare Advantage is different?
Medicare Advantage is different.
Medicare Advantage is like an upgrade to the other two, or no?
It just depends. Like I said, Medicare Advantage is for people that don't mind having an HMO and PPO. And it's going to be less out of pocket on an ongoing basis, but there's more potential there's less catastrophic because there are these out-of-pocket maximums for both doctors, doctors, hospitals, and Part D.
Okay. Another question for you regarding the supplemental, the Medigap. Is that if you don't start with it, can you upgrade to it later or add it on later?
Great question. And this is where if you don't sign up for them, there is a possibility that they can turn you down for medical, pre-conditions, prior conditions that you've had.
Yeah, yeah. Because as we get older, obviously our health is gonna, suffer, depending on our lifestyle, right? But if somebody's, it's hard to say I'm gonna be healthy forever, right? Or it's hard to say I don't want it now, but maybe say I'm 65, I don't want it now. Maybe when I turn 70, I might want to add it on then. A lot can change in a person's health from age 65 to 70, right?
You and I think exactly the same. Hey, I'll take the less expensive Medicare Advantage now while I'm healthy, and I'll just sign up for Medicare, a Medicare supplement later on. But they kind of saw us coming, Gordon.
Yeah, exactly.
And no, you don't get, you don't get something for nothing. So if you get in, you're going to be paying a much higher monthly expense. And there's a possibility if you have some conditions like diabetes or prediabetes is one of those things they're just going to say, sorry, can't do it type thing.
Okay. Makes sense.
Yeah.
Does your age and like if you have pre-existing conditions affect the cost of the plan that you choose or no?
Great question. No.
Okay.
Mm.
So that's just, so the cost is strictly based off of the annual income from the 2-year previous tax return.
Okay. Again, so the what's based on your income is what's going to the government. So that's original Medicare for
Okay.
Part B.
And Part A,
And
there's cost.
no cost for Part A, but Part B is the physicians. And
Mhm.
Part B is that goes directly to the government, and that has to do with how much you make. But
Okay.
these Medicare supplement or Medicare Advantage are not based on income at all.
Okay.
Mhm.
And what's the average cost of both the Medicare supplement and the Medicare Advantage?
Again, it's an excellent question, and one I wish I could give you, but it really depends. On a Medicare Advantage plan, you're looking at $0 to $60 a month,
Oh yeah.
and that includes the drugs. On a Medicare supplement,
I see the cost goes
for
up
a
with
female turning 65, 130 non-smoker, 130 to 140. A male, 140 to 160. I just wrote one for a 72-year-old male, and he was at 215 a month.
Mhm.
If that gives you any idea.
How
You know?
much does the cost go up annually since it increases with age?
I don't have a number for you.
Okay.
It's up to the insurance company. Insurance, it's the law of large numbers, just like any other insurance. They're looking at how much they lost last year or how much they made, and they're looking at competition. Obviously, if they can reduce the costs to be competitive, they're going to do that. Recently, a couple of major companies, Humana and Aetna, have made some pretty big announcements about their Medicare business towards Wall Street, and they haven't been very profitable. And this kind of, if you don't mind, I bleed into the next point of the conversation, which is some of the changes that are coming. One of the biggest costs associated with medicine is prescription drugs. And just leaving politics aside, these pharmacies, these drug companies, have certain costs that they're able to charge. And so the government, due to again, this is not a political statement, it's just, this is the Center for Medicare Services was directed through the Inflation Protection Act that was passed last year or this year. That was last year, I think, to change their formulary. So what they're doing is covering much, much more expensive drugs, which my understanding covers about 1.5 million beneficiaries.
Okay.
But it's putting the insurance companies in a much harder, because the insurance companies are the ones that have to pay for these drugs.
Right.
And so we expect that Part D is going to get a lot more expensive. And we also expect that some of these drugs are going to be removed, because if some of the major players aren't able to be profitable, and now they're required to reduce their profitability with higher drug costs, then we just don't know. But that's one of the expected changes we think is going to happen this year, and probably one of the major conversation points I'm going to have with people on an ongoing basis.
Right. Thank you.
Let's see here. So I've already talked about let's talk a little bit about ongoing experience, just real quick. So if you're on a Medicare Advantage plan, you're going to be essentially going to the hospital you like with the doctors you like. That's the idea anyway.
Right.
I was talking to Gordon before this call. There are major differences in how much Part D will cost you depending on what pharmacy. So you can have the same PPO, the same HMO, the same drug, the same insurance company. But if you choose Walmart versus CVS versus another one, there could be major differences in the cost of your pharmacy. So it really, really pays when you're working with someone to check the different pharmacies in your area. Sometimes mail-in is less expensive. It's never been the least expensive with anyone I've worked with, but I'm not saying it won't be. But sometimes it's close to the least expensive. So even the pharmacies can affect the cost. So each one of these details can have a major impact on each individual's specific experience in Medicare. If you're on Medicare Advantage, it's a private insurance. So you will be walking into the hospital presenting your Medicare card and presenting your Medicare Advantage card. Okay. Medicare card shows that you qualify, and the Medicare Advantage is so the doctor's office knows who to charge or the hospital knows who to charge. Okay. And then they'll be able to tell you what your copay is. If you have a Medicare supplement and you have a Plan G, you just hand them your Medicare card. That's it. Actually, any of the Medicare supplements, because the government is being charged, and then they are contacting the insurance company and saying, hey, Gordon owes this much or Dani owes this much because they didn't have a G, they had an N or an A. These different plans have less monthly costs, but they don't cover as much of the deductible.
Right.
So that's basically the experience.
Is there like a cutoff age for when you can enroll or apply for a plan?
65, and you have to get into a plan, you have to be in Part A and Part B.
And you can enroll anytime after 65?
Yes.
Okay.
You can enroll before 65.
Okay. But
you contact Social Security office.
Try to enroll like at 78 or something. They're not gonna deny. There's not like.
They're not going to deny you, but you're going to have a penalty if you haven't enrolled in B or D. Yeah, you're going to have in that example, a 13-year penalty. So you're going to be paying a lot more for Part B and D.
Okay, gotcha.
Now, part of credible insurance. TRICARE. We live in a military town here. We've got a lot of people on TRICARE, which is the military, that is considered credible insurance. So people on TRICARE aren't going to be on Medicare, but they may have a Part D plan, or they might have other types of plans as well. But most people on TRICARE are very, very happy with what they have. They might have a dental plan, is what I meant to say, because TRICARE doesn't cover dental.
And so would you recommend, I guess, people have the option to explore companies on their own, but do you think it's better to go with a broker who has access to more, so that they are being introduced not only to a single product or company, but multiples that may benefit better? Because it's kind of like us with our life insurance, we're non-captive agents, so we have access to multiple companies for, cost, price, living benefits, whatever that may be. So yeah, do you think it's just more beneficial to go with the broker that has more access, such as yourself?
Well, I might be biased in saying this, but yeah, I think that would be the smartest place to start, because what I can do, I have a tool, and essentially I can enter in the prescriptions that a patient is on. I can type in their doctors, locate their doctors, and if their prescriptions aren't covered, we can look at other formularies for them. And some people are very picky about exactly what drug, and some people say, no, I've had the generic before and I'm fine with that. And then we can find, literally, we can maximize the medical services that they're getting for each dollar they're spending with their specific circumstance.
Right. Okay. Thank you.
And then if they want, they can double check and go onto Medicare.gov. All this information is on there as well. So it's just, I kind of have a central one that filters through all the different companies that I'm an agent for, and also companies I'm not an agent for, quite frankly. So I can say, hey, I don't offer this, but it looks like this company might have a slightly better price, et cetera, et cetera. And then I can decide whether or not to become an agent with them or decide not to.
Right. Cool. Thank you.
I got a question for you, Rob. We hear about these new players, new companies in the pharmaceutical industry, like Mark Cuban started Cost Plus. Amazon, I believe, is starting to sell, prescriptions on their website. Are these interrupting anything as far as Medicare goes? Are these bringing the cost down? I mean, do they have any effect at all? I don't know what your thoughts are on something like that.
Those programs are a lot less expensive for a lot of people, and I was confronted with that with the last enrollment I had. They brought that up, and it sounded good, and they were going to save maybe $100 a month, but the Part D penalty kind of scared them, because they don't know how long these drug costs are going to be so much more competitive. And so they just said, well, we don't want to take the risk of paying 50% more after 5 years or something, because that would be a lot worse. So sometimes you just have to make an educated decision whether or not they would reduce the cost of the drugs. I sure hope so. Yeah, that's what competition is supposed to do. So exactly. I really hope so.
Okay. Another question for you, and my apologies if you talked about it all. How is Medicare funded? You talked a little bit before we got on the Zoom, or before we went live, I should say. But can you share a little bit more about that?
So Medicare is a tax. If you look at your paycheck, you'll see that 2.9% of your earnings, if you're a W-2 employee, is going to Medicare. You'll also notice that unlike Social Security, there's no maximum for the amount of wages that are taxed. So if you earn $1 million, then $29,000 is going to Medicare. Whereas with Social Security, there's a stop-off point. I think it's $161,000, maybe $163,000 this year, where you can make $1 million and you're only getting Social Security tax on 160 or 162,000, whatever the number is. So Medicare is funded that way. Now, remember we talked a little bit about Medicaid.
Yeah.
Or Medi-Cal is what it's called in California. And this is the program that the federal government and state governments have entered into an agreement with. So the state gets federal funds and also supply some of their own, but the states have to run these Medi-Cal or Medicaid programs for those who are those who are disadvantaged. Okay, so that's where the funding kind of crosses over. One of the people I'm about to sign up probably next week, she has money, but she doesn't have any income. So she's going to be getting a letter from Medi-Cal. She's on Medi-Cal now because her income is low, on whether or not she qualifies to become a Medi patient, which means Medicare, Medi-Cal. And if that's the case, what's going to happen is she's going to qualify for very robust plans, and she's not going to pay anything for any pharmaceuticals. So in this particular case, the Medicaid or Medi-Cal is basically paying the insurance company to give her services, is the way that's working. It's not coming from the state. The money's coming from the state and feds, but the insurance company's getting paid by the state.
Do they look at assets in those situations, the people that don't have any or very minimal income?
I'll be able to tell you that next week. My understanding is that there's something that says if you have assets and you want to use the Medi-Cal, then when you pass away, if you have assets beyond a certain amount, then we're going to pull that away from the estate before. But I don't know the exact answer to the question. I wish I did, but I looked it up for a client. It got very confusing very quickly.
Yeah, no worries. Yeah, because I was, you said she had money, but she doesn't have income, and so therefore she's getting potentially the best of both worlds as far as the two Medis, I guess you could say, go, right? The federal and the state. So
she has 2 homes in Southern California.
Nice, interesting. Okay.
So it's income based.
Okay. And I had another question, but I'm drawing a blank all of a sudden. So never mind. I know we're pretty much done on time, and I respect your time, Rob, and I appreciate you jumping on with us. But maybe I can email you the question when it comes up.
Oh, absolutely, and anyone else can too.
Okay. Dani, I think you're muted.
I don't think I'm ready for my quiz, Rob. I'm gonna rewatch it. I feel like
watch this like 3 times just to get everything absorbed.
Yeah, I feel like whenever there's something that you don't really know and you're presented with a lot of information, your brain is like, what? And it's just like, it makes sense, but it's like, okay, now I gotta put it all together. You catch like snippets, but you're trying so hard to pay attention that it's like your brain's on overload. My brain's on overload now.
Yeah. I definitely learned a lot though. I'm a lot more comfortable around the subject than I was an hour ago. So
right.
Yeah.
Same.
So in my prior life I was a CFP, so I didn't know all of these details about Medigap and Medicare Part C, and But what I did understand is kind of what the worst economic impact could be. So then I could put that into the financial plan and say, here's pretty much your worst financial impact. But one of the things I've come to learn, remember I told you about that client that the difference was 8,900 versus 110,000. Some drugs just are not covered by the government.
That's huge.
So every time there's a rule, there's an exception to the rule.
Yeah.
Right.
That's why people on Medicare need to keep up. That's why I think us being able to provide a service of really taking the time to help somebody every year maximize the dollar, the amount that they're spending for the amount of care that they're getting, because the plans can change and the costs are going up, and people deserve that kind of attention. And most people like me say, well, why would I talk to somebody? I don't want to get I don't want to have somebody sell me something. Well, like I said before, independent agents are not paid by the patient at all. There is no cost. It's not more expensive to work with somebody like me. Okay. So if you have a friend that's been talking to you about Medicare, or you want to even work with me, that talk about cost and find out, hey, is it more expensive to do it through you versus somebody else, or how does all that work? And I think just asking those hard questions are the best way to feel comfortable, and so forth.
Yeah, I was gonna say maybe we can turn off the shared screen, and then Rob, you can kind of share with us like who are the people you're looking to help, and how they can get in touch with you and things like that.
Oh, okay. So, my company is Informed Insurance Services, and my telephone number, I think did you put that in the chat already?
Yeah, it's in the YouTube chat. Yeah.
Yeah. And also I put a couple of resources there for people that like to do things on their own. There's Medicare.gov. You can put in your prescriptions and zip code, or Medicare.gov/plan dash compare, and that will actually allow you to compare different plans in your area. And if you have questions, you can call me at the number on the screen, and I'd be happy to kind of walk you through the tool that I have. And everything is confidential, and happy to answer any questions that anyone would have.
Yeah.
Awesome.
And if you're not on the YouTube, or if we're posting, me or Gordon happen to be posting information on social media, can we direct, if people reach out, them to you, and just have them say, hey, I was referred to you by either one of us?
Oh, that would be a blessing. Thank you. Yeah, that would be great. Thank you.
Awesome. Yeah, thank you. Well, thank you so much for your time, the information, and I'm really proud of you.
Oh, thank you.
Yeah.
Well, it feels like only about 10 minutes went by. I hope it didn't feel like 3 hours for you, but
Not
I
at
know I did a
all.
lot of talking.
No,
Yeah.
it was great. It was really
perfect.
good. I appreciate it. It was well organized, and that made it easier to understand. And then I
Thank
was
you.
also online, and I found a little graphic that just shows, it says Part A is hospital, Part B is medical, Part C is the Advantage, and Part D is prescription. So I got a little cheat sheet right here.
Good. Oh, okay.
So I can keep up, I want to
Yeah.
be able to understand this better. So, but yeah, definitely. So I'll repeat your phone number again: 760-206-6508.
Thank
Any
you. Yeah.
questions? I love that you're education based. Like, you want to really just share with people what this is about, how it can benefit them, what their options are. And so, I know you said earlier about you can sign up prior to age 65, So are you looking to speak with people, say, between the ages of 60 and 65 approximately, or closer to 65, or?
The soonest people can sign up for Medicare is 3 months before.
Oh, 3 months. Okay.
Yeah.
Okay.
So the effective date will be their birthday. It's the effective date is always the first day of the month of their birthday. But they can sign up before and just kind of have everything set. And if they have everything set and have a Medicare card, then we can enroll them in a Medicare supplement or Medicare Advantage plan. And so let's say that they've been waiting. Let's say there's somebody that retired at 63 and they're on Covered California, which is costing most people $1,000 a month or $1,200 for two people. And if they don't pay it, they're getting taxed, by the way. I don't know if you knew that.
Yeah.
That's what happens. And so they've been waiting. I'm 65. Well, they can set the stage by signing up, 3 months before turning 65. And then on their birthday that month, they don't have to pay Covered California. They're paying the $174 for the Part B, and then whatever premium, if any, on Medicare Advantage or Medicare Supplement.
Wow. Yeah. Depending on their health situation, that's a huge savings going from Covered California to Medicare.
Absolutely.
Right?
Yeah.
Okay.
Good to know.
Wow.
Awesome. Well, any other questions?
I'm good.
Awesome.
We
Well,
we have a good teacher.
yeah.
Well, let me know if you have any. Shoot me an email. I'm happy to answer them. If you have anybody that is in the middle of it and they feel like they're confused, I can, if you put me in touch with them or whatever, I can run this this tool I have and say, hey, you're exactly perfect. There's no better plan for your situation, or you can save $10 here, or whatever.
Okay.
Awesome.
It's a pretty cool tool.
Yeah.
All right, Dani, you made 100% on the quiz anyway. You always will, in my book, make the 100%. So you're good.
Thanks.
Gordon, you
I tried.
scored 100% legitimately. So what can I say, man?
I was gonna say I got work to do,
Got a cheat sheet.
but I was honest about cheating.
Okay, we'll give you that. We'll give you that.
But hey, knowing where to go is half
Yeah.
the battle, actually.
Being
Right.
resourceful,
Knowing where to
right?
get the information.
Yeah.
Yeah.
Awesome.
Well, Rob, thank you so much, though. Again, we
My
really
pleasure. It really is.
Yeah, thank you for your time. We'll have to pick your brain since we got the basics. Now we'll maybe be able to dive a little deeper into what else we need to explore on another episode, because it's been a pleasure having you on. We will be back a couple weeks from now. We'll let you know on social media somehow.
We'll communicate that then.
Our schedules that we've been kind of flip-flopping around.
But maybe Rob is willing to come back like right before open enrollment. I don't know.
Oh, yeah.
I mean, if I will probably have him sooner than that, hopefully, but yeah, maybe during that time.
Before open enrollment, I'll know whatever changes are
Okay.
kind of the major macro changes. Happy to share those with you for sure.
There you go.
We
Nice.
will look forward to it. Until then, as always, we wish you well. Have a great rest of your week. And we will look forward to seeing you here in the near future.